Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adult, and previous vice chair of the Global Health in Aging. All right, so for tonight, we're going to learn more about what are the different medical devices that helps us in rehab management. So every Thursday, we always highlight physical therapists, entrepreneurs, academicians. We even have lots of innovators nowadays that would love to share more of the different kinds of innovations that helps us physical therapists, especially October is physical therapy month. So congratulations and kudos to all physical therapy. So for tonight, we have an amazing guest. He is Ian Katz. Ian is a master's and also has bachelor's in business management. All right. He has master's in management, more than 45 years of medical device experience. He has more than 20 years, especially primarily in orthopedics, and he has more than 20 years of experience in rehab as well. So he helped a lot of people, especially in educating the different kinds of devices that help, especially in orthopedics. We're going to discuss more on how his devices or innovation help. And we are, as a physical therapist, we see lots of people under falls and then osteoporosis, what else? Osteopenia, and also how we can prevent and protect, our aging and older adults. Before I introduce more, we will learn more about him. Ian is based in Kansas right now, but originally from England. So welcome, Ian. Thank you so much for giving your time for us.
Thank you, Jenny, and pleasure to be with you and your audience.
Yes, my pleasure. So, Ian, tell us more about yourself and then definitely why you're in this kind of passion to
So
help
I'm
our aging and older adults and definitely wide base of ages.
so I'm English and have been in the orthopedic business since 1980. And around the 2000, I came across to the US with my employer at the time, which was Smith and Nephew. So I'd been running a UK orthopedic and surgical business for a number of years before that, but then came across to work in new clinical areas, such as low intensity ultrasound for fracture management with a device called Exogen. But I got to know the people that were the Exogen company that had been bought by Smith and Nephew, and they were involved also with a mechanical force which treats osteoporosis. So that's where I started to get really interested in the challenges to musculoskeletal system with age and other reasons, which manifest in either bone loss or falling or fractures or a combination of all of those things. So with the low intensity vibration technology, I've been working with Dr. Clinton Rubin since the late 1990s, and we're still learning and still developing expertise and understanding in that product range. And what I've done in the recent 10 years is move out of big company environment into running my own business as a sourcer for technology that helps with musculoskeletal health. So that's really what I do now. And I talk to a lot of physical therapists because the products that we have are very relevant to you as a group, but also to the patients that you treat.
That's true, definitely. I remember about Spinomed, and then it's really very important. And we have those bulky braces for those just simple rib fracture and very inconvenient. But right now, you're able to share different kinds of alternatives that are lightweight, and we would love to share that to our audience. And also, what are the different innovations right there for osteoporosis, as what you're saying about low intensity vibration. And thank you so much. During the recent Geriatric Rehab Summit, you gave us some sponsorship and resources on what are the different low intensity vibration benefits, you know? So thank you. All right. So let us know more about that. I believe you shared something nice presentation which you were able to deliver to us and different pictures and everything. So that's really good. Thanks for this, Ian.
That's good. So what I'd like to do now, Jenny, is just run you through who we are. That's my company and colleagues, what we do, the technologies, and then how they work for PTs and other medical professionals, but also for their patients. So our job is really to find stuff that's useful for you. And it's the management of musculoskeletal health. Why do we want to do that? Well, because people should have active, safe, and satisfying daily life. And as we talk about more the over 60s becoming a much bigger part of the future than in the past, this is a very important area. And our interests are in bone, muscle, but also the challenges that affect those two tissues. So we cluster it into products for fall prevention and protection, posture alignment, so keeping the spine straight. And there are some other areas like physical stimulation technologies, such as low-level vibration, which address bone and muscle quality and its quantity. So these are the sort of focus areas for my business. So what I'd like to do in this conversation with you tonight and your colleagues is to discuss the aging population and the musculoskeletal challenges for that group, introduce Maradyne low-intensity vibration, introduce a range of hip protection from a company called DeLock, and also talk about posture alignment products, which include the Spinamed orthosis. So if we look at the aging of our population in the United States and other developed world countries, we've got this big, large, increasing group of baby boomers, of which I'm one, going through. So we're going to be creating a much larger over 65 population than we've ever had before, proportionately to the total population. So somewhere around a 47% growth in numbers of people over 65 from a year 2022 base, and then looking at 2050. So this is a phenomenal change. But that population is different to the ones that came before. It's diverse. It's got education. You know, back in the 1960s, there were maybe 5% of people had college education. Now it's like 33% in that age group. It's wealthy. They're richer than they've ever been before. And they're also independent and seeking to remain independent. So we're more of a wellness population than a care-based population, although those two things do collide and have to be managed as we go through life at this later stage. So one of the big challenges as we get older, CDC sort of, equates to something like 25% of older people fall each year, but they don't tell anybody about it around about half the times it happens. But if you do fall over, then you've got a greater chance of falling over again. So this is a real problem. And the fear that comes out of that starts to dictate what happens. So we get this sort of self-fulfilling problem of falling, fear of falling, more falling. And they're the greatest cause of injuries for the older population, the over 65s. But they can be prevented. You know, we can reduce the number of these that are happening. And then in osteoporosis, something like 13% of the population over 50 has osteoporosis or osteopenia. And obviously women are the greater proportion of that, obviously because there's more of you. Also, you have menopause, so a faster bone loss than men have, and you have long life. but men are now catching up and now getting osteoporosis because we live longer than we did maybe 25 years ago. So it really is a condition issue for both sexes, but obviously predominantly women. Now, if we go to groups over 50 and then through to the over 65s, we've got this increasing falling risk occurring, and it's coinciding with the osteoporosis numbers. But when we get to the over 75s, then we hit this perfect storm of neurocognitive decline and challenges like dementia and Alzheimer's disease, with osteoporosis, with falls and injuries. And this is a really, really big issue and a big problem. And there are a whole load of issues that are around this, like numbers of physical therapists and medical providers that focus on the geriatric population. You know, there's much more focus on kids than there is on people when they're 60 to 100 years of age, but there's going to be more of us and we're going to have more challenges and more demands. So, you know, there are some really interesting circumstances that are going to have to be managed through over the next 10 to 20 years. So the first technology that we've got to sort of discuss with you is Maradyne. And if you or colleagues have worked with vibration plates, then you may have come across exercise vibration plates that generate G forces that can be anywhere from 1G as high as 15G. So they create a very aggressive force motion in the body, and they were developed originally for exercise and providing in a very quick period similar intensity to the musculature that's achieved when you do heavier activity sessions over a longer period of time. So their basis was quite large force transfer, but that's a challenge for an older skeleton. And around the mid-1980s going into the 1990s, Clint Rubin and a couple of other guys were looking at low-level vibration, mechanical forces, maybe an alternative approach for tissue and for challenges in bone that occur for various reasons. So the Maradyne is like an evolution of low-intensity vibration technology, and it was designed around 10 years ago. It creates so if you look at this picture on the right-hand side, basically a 0.4 G acceleration is being placed into the bottom of the foot, and it travels to the top of your head because the person stands up straight on the plate. But there's around 75% attenuation of that force before it gets to the skull, into the key regions that people are interested in with regard to osteoporosis and bone loss, which is the upper femur, femoral neck, that trochanteric area, plus the lower spine, because that's where the DXA testing is done. Then we know we get around about a 0.3 G acceleration. So the force is sufficient to achieve an effect in bone. What happens with these low-level signals, you're creating 30 small movements each second, a little bit like fast-firing muscle fiber is doing in a younger skeleton, and which has disappeared maybe more in the older skeleton. So there's a sort of dynamic occurrence in the bone marrow which stimulates mesenchymal stem cell levels, increases those, and biases those mesenchymal stem cells away from adiposity to osteoblast, chondrocyte, fibroblast, muscle cell type lineage. So it's helping to maintain quality of new tissue formation in the bone marrow. And it's very subtle. The body gets used to it. The body changes its behavior as it gets exposure to that. So 20 minutes a day of low intensity vibration is sufficient to show over periods of time improvements in bone quality and quantity. And it's a way of managing bone loss. It's also, for muscle, a good way of getting muscle condition back into the legs, which are very important for ambulation, balance, circulatory return, and a whole range of other factors. So the LIV is really like a targeted therapeutic vibration that's ideally suited for musculoskeletal tissue. And now we see current research in areas like post breast cancer treatment, so women that have had chemotherapy because of breast cancer, getting bone, muscle problems, neuropathy. The LIV is a way of actually helping them restore quality in some of the tissue, plus manage some of the symptoms of the neuropathy, but without cancer cell formation occurring. So it's quite a good non-drug method of helping to restore quality to both bone and muscle in various age groups, kids, adults, but also the bigger aging older population too. So you need around about 20 minutes a day to use this, 2 sessions of 10 minutes. It is a class 1 product in the United States, so it's a powered exercise device. Now, if you go to Canada, Australia, New Zealand, Europe, Great Britain, it's a class 2 treatment device for osteoporosis. The FDA may change this in the future, but nothing at the moment is in place. So it is a exercise device. So medical providers ought to know about it and recommend it to their patients. Their patients will be the ones that have to buy it, so it's not reimbursed. But it is a very helpful adjunct in these areas that we've been discussing. And there's a lot of science behind it. There's over 30 years now. Tens of millions of dollars have been spent on research. It's all been funded by agencies and grants. It's never been by companies. So that research base has gone through very high quality work in terms of forming the protocol, getting it funded, plus the peer review publications are high grade. Lancet, Nature, JBMR, JBJS, and other publications. So it's a very solid technology. It's made in Germany and we import them into the United States. So what can you do with it? So for physical therapists, it's got 3 areas of interest that might be relevant to what you do and the patients you see. We were talking a minute ago about this sort of area of post-cancer treatment. A 90-day period actually shows very substantial benefits. A physical therapy a research leader, Kerry Winters, is actually doing work with this in Oregon, OHSU, and published a pilot study last year, and there's now a bigger study being done in this area. The work in rehabilitation after surgical procedures like hip fracture repair, femoral fractures. This has been studied pretty well by Chinese University of Hong Kong, which is a well-respected international orthopedic trauma center and publishes to a very high level. So they've been showing that 5 days after surgery, a low-intensity vibration device can be used on someone that's had intratrochanteric fracture repair. And then over the next 6 months, they use the device 5 days a week. And they showed in their studies very good muscle and bone recovery, but also functional improvement in the group that had the LIV in addition to the standard of care compared to just the standard of care group. The area that I'm very keen to get more awareness for PTs, and particularly your group, Jenny, and others like you, is this area for the older population. So CDC in 2023 recommended low-intensity vibration as an intervention for community-based elderly people to reduce falling, based on the Dr. Leung trial, which showed over 18 months a 46% reduction in falls in the group that had the LIV compared to the group that were just doing their regular exercise. In addition to the LIV benefits, which in the muscle, which were balance improvements, strength improvements, the bone mineral density was also shown to be very positively affected in spine and hip if the individuals were doing something around 20 minutes a day of low intensity vibration use. So this is a good area for more awareness and maybe integration of this technology into balance training and retraining but also for people that are going to be in facilities where there's a higher fall risk, where this can be used safely as a way of helping to keep those people on their feet and reduce the fall risk in those sorts of groups. For independent older people, they just need to know about it. And part of our evolution in our business that we've seen is more couples that are older, women sort of plus 70 years of age are interested in it, rather than just women that maybe are 15 years younger that are worried about bone medications and want to approach bone health, through different pathways. So how would you use it in a clinic? Each of your PT clinics would have a device with a stand, and you can get some form of reimbursement for time on the device if that's the way your practice is set up. So CPT codes like 97110, etc. If you're doing one-on-one with the patient, you can use the Maridine. It can be used in neuromuscular re-education as well. But an area I think we've got to develop, and we're going to support this by having the devices available locally, is getting from PT referral to patients for, say, 90-day periods or maybe 6-month periods in conjunction with things you're doing. So balanced training, working with specific groups, like we're talking about the women that have had chemo. Post-operatively, hip replacement similar to hip fracture, although it's probably younger people, men and women. The device doesn't affect orthopedic implants in a negative way. In fact, it's quite a good bone stimulator. It helps with very good bone integration around femoral prostheses, for example. And as more hip stems now non-cemented, this is quite important, for longevity of implants, in addition to whatever it's achieving also in the acetabulum. So I think, there's an area of greater use of this that needs medical provider involvement, particularly physical therapy, because you see so many of these types of patients, to understand it and then be able to recommend to the patients the devices. And what we will do is bring them locally so that you have them on hand, so patients can get access to them. Alongside keeping people on their feet is, if they do fall over, protection has been shown to be helpful. And I think the quandary with the hip protector is it's been clearly shown if a person wears the hip protector, falls over, they're more likely not to get a hip fracture than if they don't wear the hip protector. However, it's quite difficult getting them to wear hip protectors for a whole load of reasons. So I came across a company called DeLock, who are based in New Zealand, and their products had been very well developed and designed. In a 2019 paper which looked at the force attenuation of hip protector designs, they scored 1, 2, and 3 in most effective, but had 5 of their designs in the top 7. So this is good stuff, and it basically is designed for compliance. The garments are very nice and comfortable, easy to wear. The pads can be applied or not. So if you look at the left-hand side, the blue pad, that's probably more for an older lady, right? That's maybe fallen over, possibly in a residential facility where there's a higher risk of falling again. So that scored number 3 in the technical analysis. The one at the bottom, the black one, that's a motorcycle grade pad, which, when combined with the briefs, is extremely good for the independent, active older person that's riding a bicycle, riding a horse, maybe riding a motorcycle, playing pickleball, going out running, hiking, walking, where they're worried about possibly falling over. And that could be men and women, because it overcomes the issue of stigma. It doesn't look too big when it's in the briefs, but it's designed to be very effective if a fall occurs. So I think the Deloc products help get to bridging this problem gap where you've got clinical evidence that clearly says hip protectors protect people if they're going to fall over and reduce the fractures that occur when that takes place. But at the same time, they're bridging the compliance factor by being more palatable for the older person to wear and not so obvious and unacceptable as some of the older, hard, eggshell type designs that were around maybe 10 or 15 years ago. So, I think this is quite an important area. And I do still sense that the prejudices that are out there are still there. So we've got some education to do to the patients directly, but also I think to medical providers such as yourselves that should just look at hip protectors in a slightly different way because they do have a role to play. And then the final area that obviously is key to the longer term opportunities for good and active life for the older population is managing this issue of kyphosis, hyperkyphosis, and all the problems that can occur with that, such as vertebral compression fractures, change of center of balance, and increasing falling because of less straight back. So this is where the Spinamed comes in. The Spinamed is a orthosis that was developed for a dynamic approach to the spine. So it's not like a brace which takes up all the loading and then that you get muscle atrophy associated with it. It's quite the opposite. It's actually a brace or an orthosis that encourages muscle strength. So it's got over 25 years of success. In the United States, it's been here for about 21, 22 years. It's got high compliance and it increases core muscle strength both in the anterior and the posterior musculature, reduces pain and body sway problems, improves posture, and it's also shown to be more effective for gait and balance for the people that wear it. You wear a Spinamed 2 hours a day, so it's not one that's permanently worn by the person. And the sole objective of it is to help to correct by improving the strength in the musculoskeletal structure in the core of the body. So it can be useful for things like fracture relief. So people can have a fracture in place, have the Spinamed, and it's helping to offload that fracture, which obviously reduces the pain, but also helps with the general condition of that bone and the recovery of that bone. So it's a training device, which is using biofeedback. So if you look at the left-hand side, you've got straps and tension in various directions, and it's like a 3-point loading because you have an aluminum strip that goes down the posterior spine, and then there is a strapping system which also has an anterior component. So you're applying a sort of 3-point load through the straps, and you've got a rigidity posteriorly. So this is correcting the upper back. And over time, the muscles get trained and the muscle memory goes in and the person starts to be more straight. And it's wearable. It's the Spinamed 5 now, which is the one that's currently available. It allows you to go through daily activities with it on. It's not a uncomfortable, ugly looking device. It's an extremely comfortable, functionally relevant product that you could wear around the house when you're doing various things, out on walks or doing other activities. But it provides a solution to a big problem, which is going to get bigger. So we also feel that once you've got some sort of training in the back, you need to keep at it. So, and there may be people that don't need a Spinamed that have still got a kyphotic issue. So we came up with a medium duty product, as we call it. This is a product developed from a garment that's used in younger women and men to some extent who play overhead sports. So the Velocity, which comes from a company called Topical Gear, who are based in California, is used by volleyball players and people playing overhead sports. And part of its role is to help with the shoulder and the ability to get good capability in this upper part of the body. The Velocity, though, was the good basis for a medium duty garment for women who have got kyphotic challenges in their spine. So we worked with the manufacturer and with a group of patients through two of the physical therapists that we know very well. We've made it shorter, we've made it broader in the middle, changed some of the design features so it will fit the older female anatomy compared to the younger female anatomy. And it provides like a medium duty solution where a Spinamed is maybe not necessary. But it does the same thing. It's like a bicycle shirt, so it's very close fitting. It has tension straps which pull the back around about T10 back, and it's worn for 30 minutes a day. So it's really similar to the Spinamed. It's training the muscles to improve posture and then remain in that posture. So it's not offloading, it's not taking away from the musculature, it's helping to train the muscles. But then the rest of the time, maybe you need something else. So we have a t-shirt that has a sort of tension strip built into it that addresses the upper back and helps to keep what you've already begun to correct. So a combination could be use the Reminder t-shirt with the TG garment or use the Reminder t-shirt with the Spinamed, particularly if people are going out and about doing some sports and things. And this is a t-shirt that we've, again, developed from a younger population. I haven't got all the new images yet, but we've developed it for the older population, and we'll have these at the end of the year. They're being manufactured at the moment. So hopefully this gives a solution for a big problem and an even bigger problem in the future of hyperkyphotic spines. So that's really it. These are the references that are relevant to what I've been saying. And these are my contact details. And we have two websites, marrowdyne.us, which is for the low-level vibration plate, and Copa Health.us that covers everything else. So thank you.
You're welcome. Thank you so much, Ian. That's lots of innovations and that's lots of things that can help our aging and older adults, It's very helpful, especially it's like in the beginning, like prevention will be more on Marodine Live. And then if you have it already, if you're kyphotic, you have the option on those 3 different garments. That's really good. That's really good. And then, of course, the Spinamed more on if you really want to improve that. And then, of course, another protector, which is for the well. So I thought it will be like more on that inflatable, and then that is at least, this is more, it's easy, to just put on our, like on the hips of different aging, even those like 50 plus, very active wear like horse rider and then those things that is in their bikes. Yeah, so that's
And
good.
I'd seen a statistic, Jenny. A lot of women now ride motorcycles and they're over
Yeah.
60. So one of the biggest groups of motorcycle riders are men and women in the
Mm-hmm.
over 60s, and women are about half the owners of bikes. So, there are some sort of, and e-bikes as well.
Yeah.
But we'll also bring through some products for people that need mental care, right? So if there's somebody with Alzheimer's, we've got another design of hip protector, which is a stitched in pad. So it can't be disassembled, because one of the problems could be if someone's on their own and they've got dementia or something, and they take the pad out and they forget to put it back in, we can alleviate that problem with a closed pocket design. So we'll have that for the memory care type circumstances
Nice.
later on. But generally, I hope this range is useful, functionally competent. It's got a basis of research and proof to it.
Yes, evidence based. Yeah.
Yeah, absolutely. And I think this is a really, really important part of health care and wellness over the next 20 years. And it's good for me because I'm in it, I'm in the age group.
Yes.
That's one of the reasons why I like to get out of bed and do my job in the morning, because we're working with people that are similar, but at the same time, helping to bring solutions that are maybe useful, for us.
Yes, exactly. And that's really great. It's like a wide range that, okay, you have osteoporosis, these are the things that you can do. All right, you already have this, these are the different options. So you're just like in one place that you can just provide anything bone health related and things like that. Prevention of that, improving balance and preventing falls. And then that's really great. And then thank you so much for these all brains that you're providing and different resources that you're giving to us and sharing with us. Definitely, we will share it to our group and all our patients. Our listeners are a group of therapists, and we have a couple of caregivers as well. So definitely, and thank you. I heard that you just went to private practice. So if ever, guys, you are using you have your own clinic, you can share this also to your patients, and then definitely connect with Ian on what are the different options of that Maradyne leave. And definitely it helps a lot with the slow intensity vibration. And most probably in December, we'll talk more about it, more maybe deeper use of that, of each things. So definitely. Thank you so much, Ian. Do you have any closing remarks?
Yes, I think for your listeners and viewers in Philippines, if there's any interest in either of the technology, I'll be happy to introduce them to Medi, who are the manufacturer of the Spinamed. So they would have some distribution structure in Asia Pacific, and also to the people that manufacture the Maradyne. So that's definitely there. So they just need to let me know, and I can do introductions for them if that's something that's of interest to your Philippines-based
Yes,
community.
yes. Yeah, so then we will going to post it in different groups. So US, it will be global. So I will going to put Ian's information. Definitely just connect with him wherever you're based at, even you're here US based or globally in Asia. So definitely, all right. The bottom line is we have different resources out there that will help our aging and older population. So definitely, at least you're a good resource for them. Thank you, Ian, and thank you, guys. It's
Thank
me
you very much.
again. You're welcome. That's really amazing innovations there, Ian. So congratulations. And also, Ian is from Copa Health and of course, Marathon Life. Definitely, I will put the both websites and Ian's information. All right. So thank you once again, guys. If you have any questions, connect with us. Follow us in Balance and Full Support Group, Fishigen PT and Wellness. And if ever we have further webinars and educational interviews, definitely follow us and connect with us. It's me again, Dr. Physical Therapy, Geriatric Clinical Specialist, and State Advocate here in Delaware. Thank you and God bless, guys. It's me, Dr. Jenny. All right. Good night. All right. Bye.